Colleagues, the second order of the day is the second reading of the National Health Act Amendment Bill 2025, SB 886.
Chairman Power, please approach the chair.
Distinguished senators will recall that the bill was read for the first time in this hallowed chamber on Wednesday, the 9th day of July 2025. Mr. President, you may wish to invite Her Excellency, Most Distinguished Senator Banigo Ipalibo Hari to move the motion for the bill to be read a second time.
Distinguished Senator Banigo.
Thank you, Mr. President. Distinguished colleagues, my name is Senator Dr. Banigo. I represent Rivers West Senatorial District. Mr. President, distinguished colleagues, I rise to lead the debate on the National Health Act Amendment Bill 2025, SB 886. Your Excellencies, this is a bill that seeks to amend the National Health Act number 8 of 2014 to increase the Basic Health Provision Fund from 1% to 2% of the Consolidated Revenue Fund of the federal government. Please recall that the bill was read for the first time in this hallowed chamber on the 9th day of July 2025. Mr. President, my distinguished colleagues, this bill is firmly rooted in the Constitution of the Federal Republic of Nigeria, 1999 as amended, Section 14.
Deputy Senate President.
2.
DSP. Please approach the chair.
Which provides that the security and welfare of the people shall be the primary purpose of government. Furthermore, item 17, 3D of the concurrent legislative list, part 2, second schedule, mandates all levels of government to ensure adequate medical and health facilities for all persons. By strengthening the Basic Health Care Provision Fund, this amendment directly advances these constitutional obligations. It is therefore both a legal and moral imperative. Your Excellency, Mr. President, my distinguished colleagues, the Basic Health Care Provision Fund was established under Section 2 of the National Health Act 2024 to provide a guaranteed minimum package of health services for all Nigerians. It represents Nigeria's first statutory mechanism for sustaining health financing. However, with increasing service demand, stagnating donor assistance, and persistently high out-of-pocket expenditure, now over 75% of total health expenditure, according to the National Health Account of 2022. The 1% allocation has proven insufficient to meet national health needs. Recent fiscal threats further underscore this concern. The withdrawal of the US government, support in key health programs, and Nigeria's approaching transition from Gavi, the Vaccine Alliance, mean that the country will soon shoulder greater financial responsibility for immunization, maternal health, and disease control. Without an increase in domestic financing, these developments could erode the hard-won gains in child survival, epidemic preparedness, and universal access to basic health care. Therefore, increasing the Basic Health Care Provision Fund from 1% to 2% of the Consolidated Revenue Fund is a strategic and timely intervention. It will also ensure continuity, sustainability, and national ownership of our health priorities. The National Dialogue on Health Financing, convened in September 2025 by the National Health Insurance Authority in collaboration with the Federal Ministry of Health, the Ministry of Finance, and the Governors Forum, endorsed this increase as critical to advancing universal health coverage and building health systems resilience. Your Excellency, Mr. President, my distinguished colleagues, primary health care is the bedrock of any strong health system. It is where our mothers give birth, our children are immunized, and early diseases are detected and treated. Yet, across many communities in our country, primary health centers struggle with poor infrastructure, inadequate staff, and shortages of essential medicines and commodities. By raising the Basic Healthcare Provision Fund to 2% of the CRF, we will double available funding to strengthen these frontline facilities, recruit and retain skilled health workers, and guarantee access to essential medicines and services, particularly for women, children, and our rural communities. This increase will also reduce financial hardship for households who currently bear the highest share of health costs and align Nigeria with best practices across other African countries that have adopted higher domestic health investment thresholds. Your Excellency, Mr. President, my distinguished colleagues, this amendment preserves the transparency framework already embedded in the National Health Act. The fund will continue to be administered by the National Health Care Development Agency and the National Health Insurance Authority in collaboration with states and local governments. Annual performance reports and audited accounts shall be submitted to the National Assembly to ensure effective oversight, transparency, and strict adherence to the purpose of the fund. Mr. President, my distinguished colleagues, increasing the Basic Healthcare Provision Fund from 1% to 2% will strengthen primary health systems, will improve access to affordable, quality health care, will reduce catastrophic out-of-pocket expenditure for Nigerian households. It will safeguard immunization and essential service delivery in the face of declining donor support. It will enhance epidemic preparedness and community health resilience, and it will promote economic productivity by securing the health of our workforce. In conclusion, Your Excellency, Mr. President, my distinguished colleagues, health is both a right and a constitutional duty of the state. By supporting this bill, we affirm the government's commitment to the welfare of our citizens as enshrined in our Constitution. This Senate has the opportunity to make a historic and patriotic investment in Nigeria's future, one that will ensure sustainable health care financing, that will protect our peoples from poverty due to illness, and move our nation closer to universal health coverage. I therefore urge my distinguished colleagues to support this bill for second reading and respectively move that the National Health Act Amendment Bill 2025 be read a second time and referred to the relevant committee for further legislative action. Your Excellency, Mr. President, distinguished colleagues, I so move.
Distinguished Senator